An Ipsos poll for Global News suggests 1/4 of Canadians reported that they are not strictly following the social distancing advice of public health officials. Cities across the country have also logged thousands of reports of people not following the rules. Do you have any tools left that you're willing to use to crack down on people refusing to social distance?
So at the federal level, obviously, we have certain jurisdictional responsibilities, and that's largely supporting provinces and territories in dealing with federal borders. And many of the tools that we have, we've used to varying degrees at varying times. And of course, we rely on the Special Advisory Committee of Public Health Officials to talk about additional tools that could be imposed. But I think if you look at that statistic, what it actually says to me is 75% of Canadians are actually following social distancing. And of course, it's challenging for a variety of people to do that for a variety of different reasons. We continue to add measures and continue to encourage people to do that. And of course, at provincial and municipal levels, there are a whole bunch of tools being implemented, from fines to phone lines for people to call. And I think Dr. Tam's last answer is a very important thing to reflect on. The tools that we use have to be commensurate with the risk and have to be applied in a way that don't increase suffering in people's lives to the degree that have long-lasting impacts. And we can see that the world is in a difficult place. I mean, we're trying as best as we can to beat a global pandemic, a virus which there is no cure and there is no vaccine for, using, I would say, relatively primitive tools that have been used over centuries to prevent the spread of disease. So as we do that, and as we apply additional measures, we have to be extremely thoughtful about how we do that to get to the intended public health goal, which is to reduce the spread and to actually save lives, but also understand the long-lasting implications in other people's lives and have some kindness and patience with people as they learn to live in a new way.
So I would look at this from two directions. One is supporting people to better social distance or to self-isolate. For example, we're looking at, well, do we need to provide some alternative accommodation for people who can't self-isolate appropriately at home? So working with the provinces, looking at that isolation plan. So if there are vulnerable people at home and they can't self-isolate, let's help them. So lots of these measures to help, maybe nudging and other tools. Apps are being studied in different places to see, well, how can we encourage people to know that they're not social distancing? You may have seen some of the Google work looking at, in fact, in Canada, many areas of Canada, we've really fundamentally reduced our mobility. Like in the sort of whole North American context, our province is at the top of the list in terms of reduction in mobility, for example. So those innovative tools tell us something about how our public health measures are working. Then on the other side, in terms of compliance relation to quarantine orders. So as we follow up people and check in on them, sometimes we find that we can't reach them. And we have tools to, of course, work with our peace officers to try and find them so that they will know that this is a really serious thing we're talking about. We've got a mandatory order on self-quarantine when you enter Canada, and that is serious, and we mean to look at compliance for that. So we do every day find people who haven't answered our phone calls and have to be chased down. And every province, every municipality are exercising some measure of that concept. But I think both supportive wherever possible, I think is my take. But when needed, some of these fines and compliance measures are there for an added bit of a serious message, I think.